International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Hello everyone, my name is Badrye Karami. I am PhD in Healthcare Service Management and I'm working as researcher in Behavior Disease Researcher of Kermanshah University of Medical Sciences in Iran. I will summarize the article which published in International Journal of Health Policy and Management. The title of this article is Developing a Conceptual Framework for an Age-Friendly Health System Scoping Review. As you know, population aging is occurring worldwide, and based on the World Population Prospect 2019, the world's population over the age of 65 will be more than double between 2090 and 2050. So by the year 2050, 1 in 6 people in the world will be over the age of 65. So in this study, the aim was to develop a conceptual framework for an age-friendly health system using a scoping review with the ultimate goal of providing better healthcare for older people. In this study, the conceptual framework of an age-friendly health system was designed based on the 6th stage of Oxy and O'Malley's model of scoping review. These stages are shown in this slide. The first step is identification of research questions. Second step is the identification of relevant literature. The third step is the selection of relevant studies for review. The fourth step is charting the data, and the fifth step is collecting, summarizing, and reporting findings. And finally, at the end step, consultation with expert was occurred. As you see in this flow diagram, at first the research team identify record through database searching such as PubMed, Scopus, Cochrane Library, Web of Science, Google, and Google Scholar, and 12,316 article was identified. After deleting the duplicate record, 4,450 article was included for next stage. In the next stage, the title and abstract screening was occurred, and finally, 450 article assessed for eligibility, and by many reasons such as abstract without full text or article with regional language other than Persian or English, and inaccessibility, and etc. Some article was removed, and finally 140 studies were entered for data extraction. For designing the age-friendly healthcare system conceptual framework, we conducted 3 steps. At the first step, the research team reviewed all the healthcare system models or conceptual framework in the world, and finally they agreed on one Ullman model, and we selected the basic model for continuing the process. So Van Ullman model was selected for the basic model. In the next step, we conducted a systematic scoping review based on the Oxy and O'Malley model, and based on the result 139, the item or characteristic of an age-friendly health system was extracted. And in the next stage of scoping review, and at the final step of this scoping review, consultation with expert was occurred, and the initial draft of an age-friendly healthcare system conceptual framework was approved and completed by opinion of these experts. In this study, after systematic scoping review, 140 studies were included, and this article was included about 139 characteristics of an age-friendly health system. And this finding was added to the basic model, and after applying the opinion of experts, the conceptual framework of an age-friendly health system was designed. This conceptual framework, including governance, resources, service delivery, outcome and goal, stakeholder information, age-friendly environment. As you see in this slide, the conceptual framework is interacted with the environment, and social, economic, environmental, and political determinant of health affect this conceptual framework and its function. The relationship of health system with other sectors such as education, energy, agriculture, transport, and urban planning was seen in this conceptual framework. And function of any of dimension of healthcare system, age-friendly healthcare system, was explained in this conceptual framework. And generally, this study aimed to design a conceptual framework on an age-friendly health system using the 6 stage of Archie and O'Malley model of scoping review, and consultation with expert is the excellent point of this study. And according to the result, the basic health system model of Van Ullman was selected, was the best model for the basic model of this study. In conclusion, an age-friendly health system provides evidence-based care tailored to the specific need of older people with the help of the trained geriatrics and a workforce proficient in older people care. And governance in this conceptual framework is committed to addressing ageism and providing context for the engagement of older people, their family, and caregiver to be a part of decision-making, the treatment plans. This system focuses on both medical and psychosocial factors in older adult care and concentrates on maintaining their health. Thank you for your attention.